Hi dost, hello, how are you? So, in today 10 MCQs challenge, let me start. What exactly 10 MCQs they should ask in medical competitive exams, paramedical competitive exams. Let me go with the top 10 most frequently asking MCQs of today 10 challenge. So, if we have to check the first question of today challenge, right, the question is very simple. I hope you are ready to answer this question. Right, the first question: muscle of thigh present in anterior aspect. What is the exactly of a muscle present in anterior aspect? That is what exactly today question. So options are: option A, rectus femoris; option B, right, hamstring; option C, deltoid; and option D, tibialis anterior. Which is the right answer of this question? The question is very simple, those. So if you have to check the question, muscle of a thigh, there is a thigh is forming with a different type of muscles. In this quadricep and other muscles which are helping to formation of this thigh, right, in this thigh muscle they are asking a specific area that is called as a anterior aspect. So in the anterior aspect, if you have to check with that anterior aspect, what exactly the muscle, right, present in the anterior aspect? What exactly your right answer? Fast, fast. If you have to give the answer, right, make it quick, make it quick. Right, so make it quick. What exactly the right answer of this question? Right, so here the right answer of this question, the muscle of thigh present in anterior aspect is right, rectus femoris. The muscle which we called as a rectus femoris. This is what exactly the muscle of a thigh. Right, we can see here in this image, we can see this. There is a rectus femoris. This rectus femoris, right, originated from the hip region to the knee region, right? So connecting of this, right, pelvic bone to connecting the, right, so tibial tuberosity area. This specific muscle which is called as a rectus femoris. This rectus femoris we can use for the, right, IM injection, especially IM injection at a thigh. Also we can use this type of muscle, right? So and lateral vector, right, so lateral vastalis also we can use for that, right, thigh muscle, especially that IM injection site of children, infant. That is a, right, the best site for the infant to injecting of a IM injection. Let me go with the next question, those. If you have to go with the next question of today 10 challenge, the next question is so osteoclast or known as, this is what exactly the question, osteoclast. If you have to check with this, right, so osteoclast. So what exactly the osteoclast are known as? So if you have to check this, right, a bone formation, those, very simple. There are the three different type of bony cells are present in anatomy, right, in the bone anatomy. Three different cells are present. Bone in medical terminology we called as a osteo. If it is a right, premature or bud, if it is a premature or bud, right, this bud or premature bony cell we called as a osteoblast. We called as a osteoblast. This is a immature. This bone cell is a immature. So immature bone cell, baby bone cell called as a osteoblast. Blast is a baby. So baby bone cell called as a osteoblast. If it is matured, so if it is matured bone cell, we call as a osteocyte. If it is matured, we call as a osteocyte. That is a functional bony cell. Functional bony cell, matured bony cell, which we called as a osteocyte. And one more bony cell we can see that, right, that is called as a destroyed. That is called as a destroyed bony cell. This destroyed bony cell we called as a osteoclast. Those there are the three different type of bony cells we can see. First bony cell variant called as a bud cell, premature cell, immature cell. This is a baby bony cell. And one more cell which is called as a matured bony cell, that is called as a osteocyte. And one more bony cell that is called as a osteoclast. This is a old bony cell, old bony cell. So the old bony cell which we call as a osteoclast. So osteoclast cells are helping for especially calcium balancing. Calcium balancing means when the calcium level decrease in the blood, these osteoclast cells are destroyed and release the calcium which is balanced in the blood. So this is very important. This is very important. These osteoclast cells are functioned depending of two influencing hormones. One which is called as a parathyroid hormone. One is called as a thyroid hormone. So here there is a parathyroid hormone. In the thyroid gland there is a calcitonin, that hormone called as a calcitonin, calcitonin, one hormone which is from the thyroid gland, and another hormone called as a parathyroid hormone. These two hormones which act on osteoclast cells, those that is very important, right? So simply if we have to remember this three types of bony cells. One is called as a osteoblast, another is called as a osteocyte, another is called as a osteoclast. So the question is, osteoclast are known as, osteoclast is known as here, which is called as a bone destroying cell, bone destroying cell. So here the bone forming cell that is called as a osteoblast, the bone repair and bone functioning cell called as a osteocyte, and bone destroying cell called as a osteoclast. So this is what exactly the answer. So here the right answer is B. Right answer is B. Right. Let me go with that. Next question those. Next question those. So in today the next question is the fibrous tissues connecting to bone. So here if there is a joint, so which we call as a joint in the body, in the human anatomy, especially in the skeleton anatomy, what is the meaning of a joint in the skeleton anatomy? Let me give the right answer in the comment. Those, what is called as a joint? Articulation. What is called as a joint? Joint, especially bone joint. What is called as a bone joint? This bone joint medically we call as a articulation. Those, what is the meaning of articulation? Let me tell. See, articulation simply which we termed as any two bones. This is one bone structure, this is another bone structure. So any two bones are connecting. Any two bones are connecting together, that area which is called as a joint. This joint may be the different directional, different movement. Based on that, we can answer the joints or different types of fibrous joints. So the question is very simple here. If it is a fibrous tissue joint, that fibrous tissue means connecting of these two joints. This thread, what we called, because of these two threads which holding the two bones, and that area is forming as a joint. Here, when these two bones are just tie or connected with fibrous tissue, that we called as, any two bones are connecting together, called as ligament. Ligament is very simple word which we have to observe, that ligament is nothing but here, right, any bone to bone means two bones are holding together, that called as a ligament. Otherwise, another definition also is there, that is a muscle to muscle means any two muscles holding together, two muscles are connecting together, two muscles are just tie together, that called as a ligament, that called as a ligament. So ligament can be connected any two similar organs. Similar organs are connecting with one thread, rope like structure, called as a ligament. But what exactly the tendon? tendon is nothing but here we can see that one bone connected with muscle. If bone connecting with muscle, this intermittent connecting part called as a tendon. So tendon is nothing but intermittent connecting part. So if we have to observe the tendon, it connecting the bone to muscle. Here, right? If it is the bone, right? Let me go with this image. I will show you the differentiation. Those here, this is one of the bone, right? And this is another bone. These two bones are connected, are holding with a structure called as a ligament, right? Structure called as a ligament. That means here we can see, right? We can see this is one of the bone, this is another bone. These two structures are connecting together with a ligament. But here, for example, this bone and muscle, this one called as a muscle. If it is a, right, this one called as a bone, and this is a muscle. This bone and muscle are connected with a intermittent structure that is called as a tendon. Those tendon connecting bone and muscle, but a ligament will connect muscle to muscle or bone to bone. The question is very simply they are asking here. The question is very simple, those. The question is fibrous tissue to the bones. So bones are connected with the fibrous tissues called as a ligament, bone to bone, otherwise muscle to muscle. So tendon is always the formula of bone to muscle. BM, right? BMT means bone and muscle connected with tendon, and muscle to muscle, bone to bone connected with ligament, link. Bone to bone, link. Muscle to muscle, link. But bone to muscle is, right, a tendon, T. Bone to muscle is T. That is what exactly the formula. You know that, right? And there is a options in C and B, muscle and right, a cartilage. These two are the, right, structural organs. If you have to see this, two are the structural parts. Then go with the next question. Bone without a medullary cavity. Very simple. The bone that to be without a medullary cavity. Those medullary cavity also called as a thoracic cavity. Medullary cavity also called as a thoracic cavity, right? Those we know this. This is a medullary part. In the medullary part, we can see there is a part of sternum. This is a sternum, right? And these parts we call as a ribs. These parts we call as a ribs. Back of the sternum we can see, right, vertebrae. Back of the sternum we can see vertebral columns. This total area which is called as a thoracic cage. But the question is bone without a medullary cavity means which bone is transmitted from medullary to axillary. That what exactly? See, here one bone we can see which is not relevant to sit on medullary. It can extend to the perpendicular, appendicular. So that bone called as a beauty bone. That bone called as a collar bone. Especially that bone called as a collar bone, beauty bone. This collar bone or beauty bone, what we call that? That is called as a clavicle. So clavicle is also we call as a, right, a collar bone. If we have to see this, this clavicle which is called as a axillary to perpendicular. This we call as a axillary to perpendicular. So the bone without the medullary cavity, that is called as a clavicle. In given option, let me check other options. So there is a fibula, right? Fibula, you know, lower limb bone, right? Femur, upper limb, right? Lower limb, upper bone, sorry, that, right? So femur, which is called as a thigh bone, right? And this, right, fibula and tibia, right? Lower limbs, and humerus, you know that arm bone, right? This is related to the arms, right? And this is related to the lower leg, and this is related to the upper leg. So here these three options which is called as a extremities bone. These three options which is called as a extremities bone. But here the question is bone without medullary cavity, which is not relevant in the medullary cavity, but it transmitted from the medulla, that called as a clavicle. That called as a clavicle. That is very important to remember those. Let me go with that. Right. Let me go with the next question. Right. The next question. Right. The question is example of right. So that is called as a joints, synovial joints, especially that is called as a right ellipsoid joint. If you have to see this ellipsoid joint, what exactly the example of this ellipsoid joint? So the joints of the synovial, like ball and socket, like a hinge, right? This ellipsoid, right? These all joints which is called as a synovial joints. So the question is ellipsoid joints is example of what exactly? This joint we also called as a wrist joint. This joint we also called as a wrist joint. Wrist joint. This joint especially we called as a wrist joint. So wrist joint also called as right ellipsoid joints. In given option, if we have to see, there is a knee joint that is called as a example of hinge. Ankle joint which is example of a hinge, and shoulder joint which is example of a ball and socket. And this wrist joint example of that is called as a right ellipsoid joint. So this is what exactly they are asking in the competitive. So ellipsoid joint we also call as a wrist joint, dost. Right. What is the example of this ankle and right knee joint? Ankle and knee joint which we call as a hinge joints. And we can see, right, we can see this, right, one more, we can see that shoulder, right, this shoulder also we go with this, right, hinge, right, shoulder also we can go with this, that shoulder is also called as a ball and socket, right, we can go with this all, right. Then next, right, in ankle one more ellipsoid joint also we can see, but depth of that, right. Then if you have to go with the next, the thick yellow drainage from the wound is known as. The question is very simple, those. Thick yellow drainage, thick yellow secretion from the wound. You know those wound. What is the meaning of wound? Wound is nothing but a skin puncture. If that skin punctured, right, our skin is punctured, that is called as a wound. Very simple definition of wound. Wound is nothing but right skin, right, so continuity is break, skin is punctured, that is called as a wound, right. So here the character of wound they are asking, thick yellow drainage means thick yellow secretion. If it is the wound and the wound character should be thick yellow drainage, what exactly that character we called as in the options, right, that is called as a right, that is called as a sanguineous, right, and serous sanguineous and serous and purulent, which is the right answer, Here we can see that that sanguineous wound which is called as a bright, that is called as a bright red fresh bleed, which is called as a fresh bleeding, right. If it is the skin is ruptured, a skin continuity is break, right. If it is a wound, so the wound beginning character which is called as a sanguineous, this character is a bright bleeding can see in this character. And one more, there is called as a serous sanguineous. Here serous sanguineous we can see that right yellow, right, yellow we can see the serous sanguineous. Along with that later it come to the pink. Means here also we can see that. And one more character that is called as a serous, this is pure yellow drainage. Means during the healing process, means there is a stop of the bleeding and wound go for the inflammatory process, we can see this serous character of wound. Then later if it is that wound is infectious, if the wound is infectious, it come to the pink to red and fouly smell, so that infectious characteristic wound which we called as a purulent. So here there is a thick yellow, right, only the yellow serous, and there is a thick yellow, so thick yellow character which is converted the thick yellow character which is called as a purulent. So purulent is always infectious wound, dost. That is very important to remember, that purulent is always a infectious wound. This we call as a, right, yellow thick character, yellow thick character we can able to see, right? Then the answer is D. For the sixth question, the answer is D, those. The next question is, right, hemorrhage. You know those. Hemorrhage is nothing but, hemorrhage is a medical term which means bleeding. So bleeding with a collection of blood in the soft tissue. Here we can see this, right? So there is a bleeding inside, that is internal bleeding without puncture the skin. Right? This bleeding can, right, stored under soft tissue. So this character means there is a blood vessels are damaged, either the capillaries or the veins are damaged, but there is a bleeding process and skin is not punctured, that blood is collected under the soft tissue. Dost, when the blood is collected under the soft tissue, that character what we called, if the blood is collected under the soft tissue, that character what we called, dost. So this character which we called as, right, we called as, that is called as a hematoma. That character which we called as a hematoma. Hematoma is nothing but here hemorrhage plus deposit of blood under the soft tissue. If it is bleeding, this bleeding can deposited under the soft tissue, that is called as a hematoma. Blood collected under the soft tissue called as a hematoma, right? There is a capillary means small bleeding character, means small characteristic bleeding which is called as a purpura. There is a large bleeding character, that is called as a ekmosis. There is a bruise like character, that is called as a contusion. So these are the words which we have to use for the defining of a bleeding. Small bleeding, purpura, right? Compare with the purpura, large purpura called as a ekmosis. Large purpura called as a ekmosis. If the bleeding under the soft tissue collection called as a hematoma, there is a bruise characteristic bleed which is called as a contusion. So these are the, right, options which has given in the seventh question, right? Seventh question is a hemorrhage with collecting of the blood in the soft tissue is called as a hematoma, right? Let me go with the next question. Those. So what exactly the next question? So the question is that the healing of a laceration can be promoted by, here the question is healing of laceration. So lacerated wound, if you have to see this lacerated wound, this is one type of cut, sharp cut wound. Lacerated is one type of the cutting wound. So this cutting wound can be promoted by healing of this laceration. Laceration is a one of the, right, one of the sharp cut, right, a skin cut. This we call as a skin cut. It can be promoted by in given options. Right? Here the wound is not promoted by the antibiotics. Antibiotics only play that kill the, right, microorganism, not heal the wound. It kill the microorganism. That is very important. And daily dressing also helps. Right, for preventing the infectious spread and lightly promoting the processing of inflammation and regeneration. Here pressure dressing and there is a ROM. This can be also, right, so help, but not that much of helping for the laceration. But if you have to see this, there is a laceration wound can be promoted by the pressure dressing and dry cold application. So pressure dressing and dry cold application is a best option for healing promotion of a lacerated wound. That is very important, those. So healing promotion of a lacerated wound can be possible by the pressure dressing and dry cold application. So those, go with the ninth question of today top 10. So ninth question is the complication of wound healing is, what exactly the wound healing complication? If it is a wound healing process delayed, wound healing process delayed, what exactly the complication we can able to expect? So there is a chance of infection, yes, right, that is a right, suppuration and infection can be seen. There is a chance of a hypertrophic scar we can see, that is called as a keloid formation we can see. There is a right contracture also we can see. Most commonly in these complications we can see all of these, we can see the complications. Very important, those very important of this question is infectious and hypertrophic scar and contractures, all we can see if the wound healing process is delayed. These are most common complications if the wound healing process is delayed. Then if you have to go to the next question, those next question if you have to check, there is a question like a stab wound for a drainage system is known as. So here we can see that there is a stab wound, right, for the drainage system is known as. Here there is a stab wound means any sharp right object which is deeply penetrated which to punctured, deeply penetrated which to punctured, this which we called as a punctured wound. There is a stab wound which seen that stab wound, any sharp objects right which is deeply penetrated, that is called as a punctured. Incision is nothing but, you know those, there is a surgical right surgical skin cut which is called as a incision. Any stab right stab wound, the deep penetration of this stab wound which is called as a punctured, right, that is a not related here, right, so that is a right, cautery is not related here, is related to the inflammatory. Lacerations which is similar to the punctured, but laceration can be right not compared with this punctured, there is a slightly differentiation we can able to see irregular edges of this that we call as a laceration. So here we can able to see this. So if there is a stab wound which is drainaging system, that is called as a punctured. Those, let me go to the next question, right, these are the top 10 questions of today MCQs, right. Hope you understood all top 10 questions. So next 10 questions right we can discuss in next session. Until, please subscribe, share and like the video. Thank you for watching. Take care. Bye bye.